Now, South Africa's COVID-19 numbers have spiked again. The total numbers of infections are now just below 26,000. The current death toll is climbing with 552 deaths. Around half of the people infected have since recovered. To discuss the latest figures, we're joined by Adrian Puren from the National Institute for Communicable Diseases, actually to talk about everything around COVID-19 at the present moment. Adrian, very good morning. And I want to start with you talking about the herd immunity. And we've seen Sweden take their own approach. They have not instituted any lockdowns at all. They've said they've kept their society as normal as possible, but it hasn't really worked out for them. Talk to us about herd immunity.
Yes, so thank you very much. So this is a key concept that I think we all need to bear in mind as we go down to level 3. And herd immunity is about the number of persons that need to be infected for us to actually stop the transmission of infection. And so it's a very simple formula. It's 1 minus 1 over the R naught. And you know we've been speaking about the R naught quite critically. So the R naught is about 3, let's say. So for herd immunity, we need about 50 to 70% of our society to actually have been exposed to the virus in order for us to actually prevent any other susceptible individual from becoming infected. So you've looked at the models, and let's assume that, say, 5 million South Africans are infected at the end of our first wave. That means about only 10% of our society has actually been exposed to the virus. So we've not even reached herd immunity. And the similar situation would actually apply to Sweden. I know they've not been fully laissez-faire. They actually do have some regulations about some physical or social distancing. They have certainly implied that, but I think they've tried to put more responsibility on the individual to behave in a particular way in order to prevent that. But I think it's certainly, if we look at the mortality rate, you can certainly see that that's certainly catching up with them. And that's the problem with our society currently, because we don't have a vaccine, and I'm sure we'll talk a bit more about that, is that if we simply do not have the physical distancing, the hand hygiene, the masks and so forth, we're going to overwhelm our health system. So all of those things are really key, even though we're not heading for herd immunity, and we shouldn't really be heading. It will come with time. We should still have all those features in place to protect ourselves and our communities.
Let's talk about the vaccine that you mentioned, because obviously this is critical going forward, 100%. The report this morning suggesting that the Chinese have come, they're the closest at the moment. They've come out with the results that are very impressive in terms of their vaccine that they're trying out at the moment, that they're researching at the present moment. The World Health Organization saying there's over 122 companies at the present moment who are working on vaccines. So we will probably have a vaccine within time. Just talk to us about just how critical is it, and is it possible to develop a vaccine as quickly as some people are saying they can, which is about 2 to 3 months' time?
Yes, I think we need to have a sense of skepticism about some of this. I'm sure there's good science behind some of what is being done, but I think we really need to be cautious about this. So yes, a vaccine would be ideal when we speak about herd immunity. So you really want a mass vaccine campaign to 60 to 70% of your population. But I think we need to be cautious in the sense that we don't really fully understand the immunity around the COVID virus. We have some idea that there are neutralization antibodies, but it may not be in everyone, for example. And we don't know what the durability of the immunity is as well. So I think we just need to be cautious. There's also safety considerations around vaccines, because some vaccines, even though they may have preclinical good data, but in fact, when you actually apply the vaccine, it may actually have a worse outcome than it is. So I think there's good science, but I think really need to be cautious about whether or not we will have the vaccine and the type of vaccine to really achieve an eliminating or eradicating the vaccine. I think we still don't. We're in the early phases of understanding the immunity, because when we look at other viruses in the same family, the immunity is actually short-lived. So it's like influenza. You have to have a vaccine every year, as it were, for flu, and the same may well apply for COVID virus as well.
If we have to have a vaccine every single year, that begs the question, is this going to be a patent-free vaccine? Because in this mad rush to create a vaccine at the moment, some of it is driven, obviously, it's monetary concerns. I want to create this and I want to make money out of it. You've got over 100 world leaders saying, no, this must be a patent-free vaccine. How realistic is that?
Well, it's very hard, I think, because there's lots of competition, obviously. There's always been the problem around that, but perhaps through various organizations such as the WHO and various other, such as the Bill and Melinda Gates, Gavi, for example, it's possible that one could try and ensure that there is access to the vaccine. I think people have also stated that countries should participate, like South Africa, should participate in vaccine trials, and that at least gets your foot in the door in terms of access.
That's true. Access is going to be critical. Thank you so much for shedding a bit of light on the vaccine issue for us. That's Adrian Puren from the National Institute of Communicable Diseases. We'll talk to him again tomorrow.